Hello. So we're going to talk about viral diseases of the cardiovascular lymphatic systems now, and we are going to talk about Epstein-Barr and yellow fever, dengue, and Ebola. Okay. So let's start with Epstein-Barr. Epstein-Barr virus, or HHV4 human herpes virus 4, causes diseases such as infectious mononucleosis, Burkitt's lymphoma, and it's associated with diseases like nasopharyngeal carcinoma and other cancers in patients that are immunocompromised due to malaria or AIDS. Burkitt's lymphoma is a tumor of the jaw. It's most common in children and is due to the Epstein-Barr virus. Malaria suppresses the immune system response to this virus, making usually people in endemic area for malaria more prone to develop this lymphoma. Infectious mononucleosis, which is also caused by Epstein-Barr, it's a childhood infection, but it's usually asymptomatic in children. So they can get from each other through saliva, through sharing toys, sharing utensils, sharing toothbrush, but they're usually asymptomatic. It's most common in teens and adults. Then you would see the symptoms. Okay, it's common to see in patients that have symptoms: fever, sore throat, swollen lymph nodes, and enlarged spleen. Because remember, it infects the lymphatic system, and it infects the memory B cells, and then the cells that should look like this look like enlarged and with an unusual lobed nucleus. Okay, so the shape of the nucleus changes too. Incubation period is between 4 to 7 weeks. So even all this time after being infected, you can still develop symptoms. Okay, so kissing is one of the main ways that teenagers and adults get it, because it is very common in teens, right? You like to kiss. So now we're going to talk about yellow fever. And yellow fever is another virus that is called yellow fever virus, that is usually injected into the skin from a mosquito called Aedes aegypti. In 3 to 6 days, this virus goes from the skin where you got bit to the lymph nodes and phagocytes, and then it can go to the liver, spleen, bone marrow, and brain. Fever, chills, headache, and nausea are very common. Okay, also vomiting. So these are common symptoms. The mosquitoes acquire the virus by feeding on infected primates, and then you can have the spillover, that's what they call, to humans. So we can get them directly from primates or through the mosquitoes, through the mosquitoes from the primates, or human to human through the mosquito. Okay? You can get yellow fever, for example, through a transfusion, but it's not going to pass from person to person unless you have a vector present. Okay? There is an attenuated vaccine available that is effective, that if you're going to go to an endemic area, which are usually in the tropical countries, you should get vaccinated before you go. I actually got this vaccine before I visited a country that was where it was endemic, which is actually my country. It's endemic in Brazil, so I had to take the vaccine before I went. So most of the people have no symptoms, okay? But then some people develop the symptoms, and from these people that develop the symptoms, 1 in 4 get the severe disease. So the mild symptoms are just weakness, fatigue, that may last for several months. But then 1 out of 7 people that have these symptoms may have a brief remission, and then they have the most severe symptoms, which are these, right, related to liver, spleen, bone marrow, and brain, later. So what is one sign of this more severe disease? Because it affects the liver, it impairs the ability of the liver to metabolize hemoglobin, and then you accumulate bilirubin in the blood. And in the liver, right? So the leak of bilirubin to the body makes the skin and the eyes look yellow. That's why it's called yellow fever. And that's what we call jaundice, right? The severe yellow fever can be deadly. So if, somebody has some of the symptoms that we talked about, which are general symptoms, but, you should look for a doctor if you're in an endemic area. Between 30 and 60% of patients with severe disease die. Dengue and severe dengue. So dengue is very similar to yellow fever, even in the sense that it's transmitted by the same vector, the Aedes aegypti mosquito. It's endemic in the Caribbean and tropical environments, and the dengue virus, that's the name of the virus, infects the immune system, bone marrow, liver, and endothelial cells now of the blood vessel. So it affects the blood vessels. So it is considered a classical fever outragia rash syndrome. So the person has typical fever after he got bit by the mosquito, and then the body aches, and then a rash on the skin, which is common to show in 50% of the patients. Other symptoms include retroorbital pain behind your eyeball, photophobia, lymphadenopathy, and like I said, the rash. There is a test that you can do to detect if the person has dengue, which is if they have this combination of symptoms, they put a tourniquet. It's called positive tourniquet test. They put a tourniquet, like if you're going to measure the blood pressure, right? And press that cuff, inflate it for 5 minutes, and if you see petechiae, or those little dots on the skin of the arm, in a 2.5 centimeters square of the eye, so you have to see between 20 or more petechiae and in 2.5 centimeter square in the forearm. If you see that, that is a sign of dengue. Okay. Remember that the Zika virus is from the same family of the dengue virus, and the yellow fever. So these are all hemorrhagic diseases, right? They make the patient bleed. Okay, and they belong to a family of virus called flavivirus. Let me write down for you because the thing is not here. So the family is flaviviruses. That's the name of the family. Okay. There is one thing that is effective in controlling this virus, which is there is a bacterium that is called Wolbachia. Let me get my pen so I write it to you here. Wolbachia. It's a bacteria species or genus that infect mosquitoes. Okay? The mosquito that get infected with Wolbachia may get sick in a way that they cannot get infected with other flaviviruses. And then the mosquito is immune to all this flavivirus. Dengue, yellow fever, West Nile virus is also one, Japanese encephalitis, and they don't get infected with these viruses anymore. So the bacteria protects the mosquito against these viruses, and then you stop the diseases, right? If you don't have something effective like that happening, the mosquito is going to keep transmitting the bacteria from human to human. Okay. Another hemorrhagic disease is the Ebola. So the Ebola is caused by the Ebola virus, and it's spread through infected body fluids. Okay, so one of the main things that is related to this disease is that when you get infected with this virus, it causes profuse bleeding. This virus comes from the wild, so I'm going to show you a picture in a minute talking about that, how they get transmitted. Okay, there is a vaccine that is a replication competent live attenuated recombinant vesicular stomatitis virus vaccine. What is that? You have a virus for the stomatitis, which is not a pathogenic virus in this case, because this virus is attenuated, and they recombine or they add parts of the Ebola virus to this non-pathogenic virus. And that virus starts to produce like the spike of the virus and other molecules that your immune system can see. So you're injecting as a vaccine a virus that is not pathogenic with features, with genes from the Ebola virus that your immune system is going to learn to recognize and make memory cells against it. And the protection for this vaccine is super high. It's almost 100%. So in endemic areas, it's super important that people get vaccinated with this vaccine. Okay. Symptoms. So one thing that is important is the bleeding through the eyes, through the mouth, through the feces. Also digestive system symptoms, joint pain, skin rashes, fever, headache, weakness, and internal and external bleeding. This is how this virus is transmitted. So we're going to talk about the transmission in the next slide, but the fact that the blood that is contaminated gets out of the body through the mouth, through the feces, through the vomit, makes it very easy to contaminate other people, okay, that are around that person, right? Why Ebola never caused a pandemic, being so deadly and so spread, for example, in countries in Africa. It never got bigger and through the world because the patient quickly gets really sick and in bed. And because of that, the patient is not asymptomatic and moving like what we're seeing with the COVID, right? Since the person is not moving, it's less contamination, it's less transmission. So it only transmits to those like caregivers and the people in the family that are really close to that person, but not to the general community because the person is so sick that they stay in bed, right? So that's one quote unquote good thing when it comes to Ebola not becoming a pandemic, okay? Because it's high mortality and makes people very sick, the transmission is lower, okay? That's an important thing to keep in mind. So the damage to the blood vessels interferes with the coagulation, and then you have that leaking of the blood, right? So we talked about that. Mortality rate is 90%. However, the vaccine can show 100% protection. Outbreaks recent in the Congo have been seen. There was a very important outbreak in West Africa in 2014 to 16. And the outbreaks actually started in 1976. One thing that is curious to notice is that the Ebola virus is a big virus. So if you think about this virus as measuring around 0.9 nanometers, sorry, not nanometers, micrometers. Forget what I just wrote here. Oops, that's not my eraser, hold on. I'm using multiple things here and I don't know what I'm using. Eraser. Pen. Micrometers. What is that? That is a little bigger than the smallest bacteria. So they can be bigger than a bacterium. Bacterium can be as small as 0.5 micrometers. So if you think about that, it's a big virus. Okay, so that's just a curiosity that I think it's interesting to mention. It's, I think, the biggest virus that there is. So this is how the transmission happens. You have animal to animal transmission. They start with bats. Okay, there are some bats in some caves of a specific species that can transmit it, and then transmit it into the wilderness to other animals. Humans go and try, to hunt and get animals and having contact with these animals, and they get sick. The funeral practice, being traditional, increases transmission. Unprotected healthcare workers, no gloves, no mask, increase transmission because, remember, they are having this profuse bleeding out of the body, right? And then the contact with the body fluid due to lack of care will increase the transmission. Other than this, survivors, which are not many, have this, to face this stigma as they re-enter the communities because they know that Ebola is so deadly that the person gets, some type of discrimination. Okay. So body fluids like urine, saliva, sweat, feces, vomit, breast milk, amniotic fluid, semen, all these can transmit. And objects such as clothes, bedding, needles, medical equipment also can transmit. The semen from a man that is recovered from Ebola virus disease can still carry the virus. So that's another problem. Okay. Even if they're not sick anymore and don't have any symptoms, so they remain in the semen. So that's a way to transmit. There is no evidence that Ebola can be spread through sex or other contact with vaginal fluids from a woman who had Ebola, but they can be transmitted through men. Okay. Little risk to travelers or to the general public who have not been in contact with somebody sick. So even if you are in an endemic area, if you were not in contact with somebody sick within like 3 feet, then you don't have to really worry about it. Okay? They're not going to be transmitted through fomites far from that area where the person is infected, unless you are in the same house or in the same environment. All right, so this is it for viral diseases, and I'll see you when we talk about protozoan and helminthic diseases in the next video.